Okay, it's a couple minutes past the hour and we've got a good number of people on, so let's get started. Hi, everyone. I'm April Harrington. I'm the project manager of the Chicagoland Healthcare Workforce Collaborative. Thank you all so much for joining us for the first in our series of 3 Lunch and Learn sessions this February. These are hosted by our steering committee. Thank you to all of them for your work planning these. So this one today is called Identifying and Addressing Challenges to Workforce Pathway Programs, presented by our team at Rush. We have Rukiya Curvey-Johnson, who sits on our steering committee at CHWC. She's the VP of Community Health Equity at Rush and the Executive Director of the Rush Education and Career Hub. And she is joined by Grant J. Higgins, who is an HR generalist anchor mission at Rush University Medical Center. And before I pass it on to them, I think most of you are familiar with CHWC, but if you are not, we are an employer-led sector partnership here in Chicagoland. We have 13 of Chicago's major health and hospital systems at the table, supported by 15 strategic partners, including training providers, community organizations, and workforce development entities. And we come together to support an inclusive healthcare workforce. So we focus on recruiting from populations with high rates of unemployment or underemployment. We also focus on strengthening the bonds between employers and training providers to innovate new training models. And finally, we also focus on offering career pathways and supporting career retention so that we're not just putting people into frontline positions in healthcare, but we're also providing pathways up into quality careers. This is, like I said, this is the first of 3 Lunch and Learn series sessions this February. Our next one is next week on February 15th. On inclusive hiring strategies and lessons learned from our University of Chicago medicine team. Ashley Casiello, who is on our steering committee, will be hosting that with Audrey Gammett to discuss their talent strategy, their strategies at UChicago and what they've learned through those. Then on February 21st, we'll hear from the team at Advocate Aurora Health on their new team member success coaching. That's a new model that they're implementing to support frontline newly hired staff members who have barriers to retention. And then on February 22nd, CHWC is partnering with the Healthcare Council of Chicago on a panel discussion titled Creating Pathways for the Next Generation of Healthcare Leaders. That panel isn't fully set, but I myself will be moderating. I hope some of you will join that as well. And then finally, our first quarterly meeting of the year will be on March 14th in the morning, as always. And that'll include a lot of updates on our work at CHWC. So I'm going to drop the links to register for each of these in the chat momentarily, and I will also include them with an email tomorrow. I will email all of you who registered the recording of this event and the slides and links to all these events. Oh, and finally, CHWC is also hosting an info session for high school students. It includes summer internships, but also some year-long mentorship and volunteer opportunities for high school students to sign up for. That is in the evening on February 21st, 5 to 6 p.m. I will also include the flyer for that and additional information in the email I send you tomorrow. Any help you can do to promote that to high school students would be greatly appreciated. And so without further ado, I will pass it off to Rukiya and Grant.
All right, thank you, April. I want to thank everyone for joining us this afternoon. Part of what we'll do is really we wanted to have a discussion. And so, yes, we're going to go through and identify some of the challenges that we've had here at Rush, but also we want to get a chance to hear from you all or give you a chance to talk about your experiences with this work, and to also really give you a chance to share out about what you're doing and also find additional ways to connect and collaborate. All right, so just a little bit about me. So I have the honor of leading our community health equity and engagement team and at Rush, as well as serving as the executive director of the Rush Education and Career Hub. I've spent over 20 years in education and workforce and community engagement outreach, and I will turn it over to my colleague Grant to introduce himself.
All right. Thanks, Rukiya. Well, I work as an HR generalist, as April and Rukiya said, and I support our pathway programming, some of our diversity and inclusion initiatives, as well as workforce development efforts at Rush. And I specifically lead the quote, Beyond the Diploma PCT pathway program with a partnership from Rush's professional nursing practice. And as you see on the last sentence, I am a huge Wolverine fan, so happy to be here today to talk about some of our challenges and strategies. So thank you.
All right, so a bit about Rush. We are an academic health system. We do have sites across the Chicagoland area. And actually what we'll focus on mostly today is around our Rush University Medical Center efforts that are located here in Chicago. And again, the mission of Rush is to improve the health of the individuals and the diverse communities we serve through the integration of outstanding patient care, education, research, and community partnerships. We are among the nation's best in terms of quality, and we are also a leader in the equity space. And that is part of what I want to make sure we lift up as we think about our programming. A huge driver for us with this work was our imperative for action around addressing health disparities. And what we know about addressing health disparities, it means actually addressing those social determinants of health that happen outside of the hospital walls. So providing opportunity for access to quality education, and in this instance, quality employment. Particularly, we are focused on our west side of Chicago sort of zip codes, but we also on a broader sort of scale look at Chicago in general for our programming and outreach. And so to guide us in this discussion and part of what we are thinking about and why this work is so important, of course, is that workforce pathway programs are critical for addressing the labor shortages that we see here today, but it's imperative that we think about tomorrow and the future. And so we did want to think about what are some of those top challenges for implementing workforce pathway programs. We know we are all in this space, whether you're an employer side or you are an educator or training partner or a community-based organization that provides workforce development. There are some common and sort of top challenges that plague the work, if you will. And then there's thinking about the challenges for community workers, folks who are just coming into an organization, and then that what happens once folks get into an organization? What are the challenges around implementing workforce pathway programs for incumbent workers? And then, of course, we want to think about some strategies for addressing those challenges and what's next. So I'm going to turn it over to Grant.
All right. Thanks, Rukiya. Well, we also wanted to provide a little bit of an overview. Oh, we good?
There you go.
Awesome. So we just want to provide an overview of the program assessment of programs that exist at Rush. And we met with leaders, sent out communication to identify those workforce development programs that exist. And we found over 20 of them throughout the system. But before we go into that discussion, wanted to state and really emphasize the importance of those programs. And given the war on talent, workforce development programs really address those external challenges that everybody in healthcare and everybody on this call is experiencing. And frankly, they help develop clear pathways to fill those vacant and hard to fill positions. And specifically at Rush, why are we targeting these programs within these areas in particular? Well, it's because they target open roles and support some of our most vulnerable areas, which enables them to have the biggest maximum impact for our organization. And they can also bridge the gap between our staffing issues, our anchor mission efforts by increasing our West Side local hires. Okay, so as we go into the programs, just want to give a high-level overview of some of the programs that we have here at Rush. So we have the Beyond the Diploma PCT Pathway program, which is the main program that I support as program lead. And we actually just finished our first cohort this December in our revived structure with new program partners. And we're very happy to say that all individuals who finished the program received an employment opportunity at Rush, and they're all currently working in PCT roles at the moment, which is really exciting and I'm proud about. Then we also have the medical assistant pathway program, the medical assistant apprenticeship program, a couple programs within nursing, and then Rukiya is also going to speak a little bit about the Rush Education and Career Hub programs on the next slide. But we also have some other programs in development with Oak Park, around our system with Triton College. We have a ADN to BSN hiring program that's in development and currently underway, which we're currently recruiting for with Lewis University. And then we also have a jump hire and supply chain training program as well. But it's also very important to think about the key metrics of these programs. And, as Rukiya stated, Rush is a great place to work. And so there's a lot of applicants that we have to these programs. And we have an average amount, given the total programs that we have currently available, of around 300, which is really impressive and I think we're proud of. But the average cohort size in terms of the range from smallest to biggest ranges anywhere from 5 individuals to 60, like our Rush Education and Career Hub pathway programs. And so we have an acceptance rate of about 10 to 15% for these programs. And the number of learners across all these programs within the last fiscal year should be around 165, which is great as well. And then we have for the average completion in terms of how many people start and finish these programs around 75 to 80%, which is also really phenomenal. But the most important thing I think I want to emphasize in this slide is the number hired into roles for direct hire programs like the Beyond the Diploma, like the medical assistant pathway program and the medical assistant apprenticeship program, which we have. And in the last calendar year, we had 19 hires, including those 3 programs. So I think that's really a proud effort that we're very excited to share with this group. Anything else, Rukiya?
No, I was just gonna say a thing to note, the number of hires is so much smaller, just for point of reference, is because a large number of the learners, when you look at that number, actually reflects our high school and college programs. And so they are not eligible, like they're not all going into direct employment, direct full-time employment right away. That's something we hope to see down the line. It's a long game.
Mm-hmm. Thank you. So we also want to provide some more detail about these 3 programs and really highlight the work that has been done and, review some of the successes that we have. So the Beyond the Diploma program is a pipeline program that supports our anchor mission. And we have the support of Westside United and the partnership, who is one of our funders for this program. So we work with individuals from the West Side who aspire to work in healthcare, but would really be unable to do so without this program. And so in partnership with Westside United and the Tugendorf Training Institute, the Chicago Urban League, this is a fully funded opportunity for participants to earn their basic nursing assistant certification while also working in a non-clinical observatory role at Rush as a patient services assistant once a week. And I really believe that this is a great program because participants receive professional development and mentorship, their certification, which is fully funded, and ultimately an opportunity to gain invaluable clinical exposure at Rush University Medical Center. And just a quick plug to this group, we are recruiting for our second cohort right now, have a group of 19 participants, which we're really excited about to get them onboarded and start later this month. So very exciting. And then we also have the medical assistant pathway program in which I provide partnership. And I'm sure individuals I see some familiar faces on this call. So, this program provides Malcolm X students who are 2 semesters away from getting their MA certification with fully funded tuition, professional development, and a externship opportunity at one of the healthcare partners at part of that collaborative, specifically at Rush. And upon completion of this role in this program, they will transition into an open MA role after program completion. Okay.
All right. So actually, I will answer a question. I think this is good here. Betsy asks, is the funding for the BNA certification program covered through grants or through Rush investments?
Yeah, I can do that. So this funding is actually provided by Westside United. They supported our first cohort, and we're very happy to have them support the tuition for our second cohort as well. So that is the Westside United Advancing Cities JP Morgan grant.
Right. So it's a grant, and a number of other healthcare systems are also a part of that too. And so the last one we have here is the MedSTEM Pathways program, which is targeted towards high school students. It is a 6-week summer program. That's the signature program. We do offer something during the school year, but it is fairly large. On average, we have 60 to 75 interns. And I think the important thing to note here is when you think about a pipeline and an early workforce, we have about 60% of our interns returning each year, and students are earning stackable credentials. So in their early years, they start with CPR and they move on to EKG and phlebotomy and CNAs. And so they are able to, for a lot of our students, as they graduate high school and they go to college, they often work part-time. And so they're able to work part-time as patient care techs, as phlebotomy, phlebotomists, or they're also, we connect them with other opportunities. We have them work in IT. We actually have an IT pathway also that's a part of this. And so they'll work with our IS department, as well as we've had some go into the farm tech space. So the main point here is really thinking about that opening the field for a lot of Black and Latinx youth, but primarily it's thinking about those early entry careers and stackable credentials that can grow with the with young people as they continue their educational journey.
And then just another quick note about the Beyond the Diploma program is we actually source some of our candidates from alumni of these MedSTEM pathways and Rush Education and Career Hub, youth outreach efforts. So that's another way that we try to source those candidates and keep them connected to opportunities throughout our system. So we understand the programs that exist at Rush and some of the successes that, these programs are really important for, but also wanted to discuss and review the top challenges from our perspective, and not only implementing these programs, but the challenges with managing them. And so workforce development programs like those at Rush concentrate on those specific populations and geographies that are most affected by underemployment and unemployment. And because these groups often, experience challenges and obstacles in securing employment, they may lack the appropriate and adequate prerequisites or educational qualifications, such as a diploma or a certification. So one of the major barriers for entry for these applicants is that due to the sheer number and volume of applicants and applications, and perhaps even screening processes that may be automated, there is a lot of difficulty in an application that will be screened out. And so we want to address those and develop a method to match employees and surrounding community members to specific jobs that they are eligible for based on those background and skills that they have. And then arguably the biggest challenge for pathway programs, and I'm sure many of you are familiar with this, is the life challenges that participants experience in the programs. So whether that is through family obligations, medical emergencies, transportation, or childcare assistance, participants in these pathway programs have a lot going on. It's especially hard given the program requirements, any outside school or work that they're in, as well as family life. So, for example, individuals in our programs have consistently required transportation assistance to get to and from those in-person requirements, either because they are spending too much money on gas, or they're taking a rideshare service and can't keep up with the expenses, or they don't have a public transportation route that is getting them to and from their requirements, and it's not consistent enough. So focusing in addressing transportation assistance is going to be a focus area and challenge for participants. And moreover, childcare assistance is really critical. We experience past attrition because individuals cannot find and secure childcare assistance and support that is both effective for their schedules, that is within close proximity to where they are working, and to where they're able to get to and from to, and ultimately that is affordable for these individuals in these programs. So childcare assistance is always going to be a challenge to think about in order for participants to be successful. And then we also have inadequate orientation and scheduling expectations, and that's definitely a barrier for the success of participants, because individuals who do not have a good idea about the scheduled requirements and are not going to be successful. Especially if there's a lot going on in their lives. It's important to think about every aspect of the program and communicating that to the individuals before the program actually starts, so they have the adequate information, and they understand that they can physically attend and complete those requirements is another really important challenge that you want to address when thinking about implementing these types of programs. I see some questions coming in about the addressing, and so
answer those. Some of those will be in the next slide.
Right. But also we have communication. It's a massive challenge, either through program leads to the partners, the students to the program administrators. Ensuring that communication is consistent is, difficult. It's hard to keep everybody on the same page and have an accurate depiction of the student's progression to keep them on track to be successful if there is no consistent communication. And so ensuring that we have those communication routes and strategies is really important to make sure that students are progressing and on track to be successful. And then lastly, tutoring is a major challenge for many of these programs that focus on, opportunity youth and individuals who are of a certain geography or background, since, they might have been out of school for a while, or they might lack certain educational skills. So it's very important to think about addressing tutoring and providing educational wraparound support to assist participants through their program, specifically if it's an educational training program. Right.
All right. So what we want to do now is actually do a breakout. And we want you in your breakouts to talk about the top 2 challenges you might be facing in your programs from whatever side of the fence you may be on, as an employer, as an educator, partner, or a community-based organization. And, to think about those top 2 challenges, and then what would be the impact of having those challenges addressed? Because to be very frank, as April mentioned, I'm on the steering committee for Chicagoland Healthcare Workforce Collaborative. I'm at a number of other tables, but beyond that, if we can think about what are 1 or 2 things that we can collectively address, right? If we can sort of prioritize, what might be the impact of that if we can hone in on a few, and sort of, we can't boil the ocean, but where can we start, right, as a collective? So want to do a breakout now, and I'm just going to do, sort of the random break us out into a couple of rooms and give folks a chance to talk. All right.
Community programs for, and where's that threshold of, this is when we really do need to be teaching you things that are a little bit more system or hospital specific, so that we can kind of come together to solve a problem. I know that's a little bit vague, but just trying to think through that balance of what we need to do internally and how we can leverage more joint resources.
I'd welcome talking to you more about that, Kathleen. I'm always looking to have brainstorming conversations like this. This is a good group. And Kathleen, I think this is the first time I really have spoken with you. I know we've, been in the same
One thing before we lose a breakout, what does the community trust? What do MacArthur, what do those big funders want to see from us?
All right. So I know I heard some great discussions in my group in terms of some challenges and hearing about impact of addressing some of those challenges. Would love, maybe we can have two people share out from their respective groups. I can certainly call on anyone, but if someone would like to just share from your respective group. Y'all gonna make me call on somebody? All right, Mary, I'm looking at you, Mary Schmidt.
Thanks, Rukiya. One of the things that I discussed is the availability of preceptors. And that, we understand that there already are staffing issues, certainly with CNAs, as well as, a wide variety of different roles. And so that, coupled with onboarding new employees, can prevent students from going through their clinical externship. So that's definitely a challenge. And one of the Stevie Rodriguez had brought up the desire to share more the cadences with which, that they're operating under to accept students, which would be greatly helpful for a college to understand a little bit better when students can, when we should submit a request in order to have students accepted for clinical. So those are a couple of the challenges that are, facing our group.
Thank you. Would any other person from another group like to share? Okay.
I'll speak up for our group. We had some representatives from University of Chicago Medicine and Northwestern and the VA, as well as Upwardly Global. And one of the themes that we talked about was, generally a need for funding, which I think is always there, more grant funding or internal funding. And where that really makes a huge difference is the capacity of teams to carry out this work. As Grant was talking about, it's a lot of work to support participants successfully through a program. And so having the staff capacity or the staff capacity to manage partnerships that might be doing that is a huge challenge. And sometimes that includes some bureaucracy, some regulatory barriers that delay processes, and you lose participants in the process.
Thank you. All right, so we are going to jump now to a few strategies that Rush that we've implemented to address some of the challenges, and they're certainly not completely comprehensive, but definitely hit a couple of key areas. So one, I think, is we all know to do this kind of work, having enough FTE to support. And what we've found is in the case of Rush and probably in the case of a couple of places, you have people in a number of different departments that might be working on this. And so in our case, like Grant actually sits in HR to support this effort. And then there's my team with the Rush Education and Career Hub, which is out of our Equity and Engagement office. It is a whole other group to support this effort, but more broadly, we have leadership support. And that's, as you all know, you cannot underscore enough how important it is to have your leaders on board from the CEO on down to be able to support this effort, because you need FTE to do like the higher or stronger levels of case management, obviously to do just the programmatic work around managing these programs and just the level of engagement that's necessary, because it is a very labor intensive initiative, if you will, to be able to implement. And so every year being able to make the case and the sustained funding for workforce programs are necessary. And I think there's also, if you have the ability to bring sort of the business case too around this, what does it mean? Or how are you able to obviously fulfill certain roles, keep them in? How does that affect retention or, dollars that might be spent otherwise on higher recruitment or contract labor? Being able to answer those questions, I think, are also very helpful. Another thing that we do is leverage different partners. So what I mean by this, we all are probably leveraging different partners, but there are a fair number of organizations, I think, across the country and, not just locally looking at each other, but there are also a number of organizations that provide different resources, templates, and tools. There are a number of things that you don't need to start from scratch. I know Advocate Aurora has done some fabulous work around some career development ladders and some case management. There's also Jobs for the Future. That's a national organization focused on, economic mobility and career workforce. There are just a number of organizations like that that could be references or consulting partners potentially to help address the challenges you see here. And then you also have partners who they are interested in the same things, right? And so they might have resources to provide that case management that you can't. So whether it is the Chicago Urban League, like these are other organizations that can also write grants potentially and get the resources that you're able to bring to the table. Employer partners, if you are an employer and you're able to dedicate the energy to bring those partners to the table, there's a lot, you're able to do, because that's half the battle for an educational partner or some of these other community organizations. And then on the educator partner side, there've been a lot of dollars that have been allocated, especially over the past couple of years, to educational institutions, to the higher ed organizations to actually support workforce development, and thinking about how we can tap more closely into those as employer partners, I think is, potentially is critical. The other thing that we've implemented is an equity assessment tool. So we have what's called a health equity assessment tool for wraparound support and assistance. And basically when anyone who applies, right now it hasn't been, and that's the thing, it hasn't been implemented consistently across all of our RUSH programs, but at the very least right now with our RUSH Education and Career Hub programs, every student that is enrolled takes this assessment, and we actually do assess for critical needs around food and health and housing and technology. Do you have a Wi-Fi? Do you have Wi-Fi? Is it spotty? Do you need a hotspot? All of those things. Do you need assistance with rent? Mental health and wellness resources. Those are another sort of key area of wraparound support and assistance that's required. And then also offering that professional development and soft skills training, and even that enrichment, that academic enrichment training is another space. And so for healthcare systems, what, just as an FYI, what we've done is leverage NowPal. So if you have the electronic medical record and you're already doing SDOH screening, that social determinants of health screening, we've actually worked with NowPal to develop a more customized one that's tied to educational sort of programming. So we were able to update the resources that are available, and to also include educational resources that we can refer people to, and programs and things like that, and more of the childcare pieces and after school programs, to be able to include that as a set of referral partners, if you will, or referral resources within NowPal. And so it's specialized for that group. So that is a set of sort of strategies that we've implemented to date. I see, Anna, you said, will we be willing to share a list? Yes, I will be willing to share a list of some of the external partners that we've leveraged. And so, looking at the time, I wanted to do another breakout, but I don't know if we'll fully have the time for that before going to next steps, but I would want to find out from the group. We heard a fair number of ideas about strategies to address some of the challenges. And I do wonder from, from the group, out of the challenges you heard within your group and some of the solutions, are there particular ones that you want to lift up for the collaborative to be able to address? And I have some other ones in the next step, but if anyone would like to share, if the collaborative or other like-minded, the health and medicine policy research group, or there's this new Greater Chicagoland Economic Development, group, if there's something that they can we can lift up as a collective to address. Is there anything, funding we know is one. So let's, we'll put that on the list, but anything else that folks want to lift up? And if not, I can do next steps and open for questions. Okay, so nothing in the moment. So I'll do some of the next steps that we essentially have. So one of the things, we thought about, of course, is partnering to go deeper with our educational institutions and community organizations. So I mentioned that a bit briefly in terms of really thinking about how to partner more closely with our educational partners based on where they're looking to go, but also obviously meeting the needs of the employer, but thinking about how to leverage the resources that have now been given to higher ed organizations to support workforce. A lot of federal funding opportunities or different things, they are really into collaboratives. They're really into groups applying sort of as partners. And yes, it takes more work and it's a lift, but those are available resources and dollars that we should be sort of working together to tap to be able to best support, both our students and potential candidates for hire. So those are some things. We also noted identifying the most vulnerable areas and focusing on jobs with clear career pathways or creating those. So Grant and I actually were just in a presentation earlier this morning with this company U3 who does hiring analysis, like looking at our hires, looking at where turnover happens, where the position, which turnover happens in different positions. Because we have a focus on hiring local as an anchor institution, he's also able to look at the turnover rates for those folks in those specific zip codes. But what he was able to tease out in some instance were jobs with lower turnover that paid a family sustaining wage that also met sort of that lower educational requirement, did not require a bachelor's degree. And so when you think about the fact that you might have high turnover, nursing notwithstanding, right? But you might have higher turnover in certain kinds of roles in your EVS, in your food assistance, in patient care techs. If you can clearly outline a career pathway of development that takes people, sort of in a stackable way, where you want to call it micro-credentialing, but you support them along the way, and be able to show them this career path that'll lead them to greater earning potential, then that might be a great way to support your incumbent staff, but also a way to bring on and hire people in certain targeted neighborhoods that you might have identified, as well as just strengthening that retention effort. The other thing is to work towards strengthening efforts around lowering barriers to entry. I think there's been some interest in general of thinking about justice-involved individuals. And I know Rush right now, we don't really do that as much. And it's something that we really want to think about how to learn together with this collaborative and group thinking about policies or different things we might be able to put in place to support bringing on individuals who have been justice involved to provide greater access to opportunity overall. And then collaborating with others, as I just mentioned, to advance advocacy efforts, thinking about those, of course, workforce development initiatives like the Good Jobs Challenge, developing more preceptors. So Mary mentioned the need, that is, of course, the need, right? All along, all across the board is a need for more preceptors. And really, there are a couple of opportunities, but something we can also explore in terms of funding to develop more preceptors. You have people who are, instead of leaving the profession completely, can we turn them into preceptors or educators to be able to support the clinical, rotations as well as mentorship, and not having to have them be in the full-time role, but having some other role that is defined more around preceptorship and education. So considering that as a collective, I think that's something, we could all pursue. And then thinking about how to connect training to greater or broader economic development efforts. Again, seeing what is happening across the region. Are there opportunities to tap into workforce development fundings there? And overall enhancing our retention efforts with a stronger onboarding program. And what that means for us is, in essence, I don't know about everybody else, but onboarding, here at Rush could look like you come in, we just started doing things back, in person, you get that blast, fire hose of all this information, you meet people on the floor, but it's like, and then you're sort of left to your own devices, right? And so it's thinking about how to have a more comprehensive onboarding, maybe there's a buddy program, something that allows us to wrap our arms a bit around people to support them along the way, so that onboarding is maybe 3 months, right? Instead of just like a one day come in and learn things. Because I think, as we know right now, there are a lot less young people going to college. When you think about post-secondary, what are certifications that they're earning, the type of training that they're doing, we're at crisis mode now. We're already seeing it, and it's even further because you have less students going to college, less who are feeling like I need to spend the money on the four-year degree. So what is it that we're going to be able to do as a collective to potentially strengthen all of these efforts to reach as many people as possible and to bring people on is something that I think we have to strongly consider and dramatically change how we're doing workforce development across our industry. So I'll stop sharing. I'm not sure if there are any other questions. And I've left 5 minutes. And it looks like no questions.
No questions here, just Alicia at Cook County Health. You guys are really doing great work. April, you leading the collaborative, and Grant and Rukiya over at Rush is really a model to follow. So thank you for sharing.
Thank you.
Yeah, Rukiya and Grant, I think this has been a fantastic presentation. Thank you so much for the time and effort you've put in. I do have one question, but before I get there, I do have a very quick five question survey for everyone to take. Helps us know what you think of these Lunch and Learn series. As I mentioned at the beginning, there are 2 more, so I hope you join us next week to hear from the U Chicago Medicine team, and the week after to hear from Advocate Aurora. I will email out those registration links, and please fill out that survey. And I was curious, Grant and Rukiya, if there's anything interesting that you've learned from, I think the name of the company was U3 that's doing your hiring analysis. Anything surprising that you learned that sort of went against the grain of who you thought was turning over, or anything that's been particularly useful to act on? I don't know. Any insights?
Do you have any? I have two, but I can do one.
I just think the concentration of specific types of groups and roles is something to really focus on. Specifically within our entry level positions, there is a huge, overwhelming majority of our anchor mission folks and people of color who are in these sort of areas. So it's important to think about those in terms of offering either incumbent worker training, professional development, mentorship, so that there are opportunities for career advancement. And I think that's one area where the data supports what you're trying to do. So that was one thing that I think it was good to hear and reinforce some of the interest in those career advancement opportunities for incumbent employees were kind of clustered in those lower paying, lower entry level positions. So that was one highlight that I think was really important for me to understand.
Yeah, and in addition to, I mean, just to be frank, the fact that we do have so many of our positions, like lower entry wage positions clustered with people of color, that was something that was, I think we all knew it, but I think to see it, gives additional motivation to do different types of work. But one other thing that stood out that was a surprise, at least to the UD person, was our community health worker retention levels. They are overwhelmingly, of course, hired from our local service areas or right here on the west side primarily. And we have a much lower turnover rate with them. And so he was like, what are y'all doing, with them? And one of the things we have been able to do, it's almost like because we were able to start sort of fresh, was to be very intentional about their development, meaning when they come in to the organization, we talk to them about, yes, you might be hired in and you're going to work on this initiative with the city to do vaccinations, but here are 4 other areas that you can work. The ED, the cancer center, you can work with our school, school-based health centers, or work with our school groups. And I think for them, seeing sort of the range of opportunities and the opportunity to rotate based on some of their interests has been really helpful. And a lot of them, we've been able to say, oh, you're interested in getting into actually the clinical side, where let you rotate with our College of Nursing or with, in the ED, so that you can start to get that exposure, and then let's direct you to other learning and training opportunities. So I think being very intentional upfront about a career ladder or a pathway for them has been helpful.
That is super fascinating. And an hour goes by very quickly when you're talking about something so big. My final question, and I know people will drop off, have you thought about any of those learnings with the CHWs? It sounds like you're exposing them to a variety of different pathways to advance. Have you taken that learning and embedded it, say, in your PCT program or elsewhere?
We haven't yet. That's, I think, the next
That's
step.
the goal. That's the goal. as Rukiya is
step.
saying, that's the goal, to introduce those opportunities. And
yeah. So though they're fairly new, like this is 3 years. So like now we have 3 years of data in with this, and now we feel like we can take it to the next level.
Got it. Wonderful. Well, thank you so much, Rukiya and Grant. I really appreciate the time that you've spent preparing this today. It's been amazing to learn about all the great stuff you're doing at Rush. I hope you'll send me your slides so that I can send them out to this entire group with the recording. And I know I have some different ideas of what the collaborative can do together coming away from this conversation. So thank you so much.
Thank you.
Thank
Have a great
you.
day, y'all.
Great afternoon.
Appreciate it.
Bye.